It's like, did I just waste all these years and I don't want to do this? And it really took like that opportunity to open my eyes and see that just because you're a licensed professional counselor, I could probably count on one hand how many like true therapy sessions I've done, because there's so many other things we can do. And these community mental health agencies that I've worked for, like BJC as the intake coordinator, was community mental health nonprofit. And then same thing here. I think it opened way more doors.
I was very clear from the beginning when I started in 2018 that I wanted to be a director. Whatever that might look like, I wanted to be that. So from day one, every supervisor and director I've had has known that. So they have tailored my tasks. They've tailored all of that to get me to my goal. And now I'm sitting here as a regional director for our residential program. So it's a company unlike others.
You're listening to Mentor Moments, where we talk about all things counseling, technology, education, and career development. I am Braden Wooters, and I'm joined by my co-host, Dr. Michael Keener. Grab a seat, and let's get started. Okay, welcome back to another episode of Mentor Moments. My name is Braden Wooters.
And I am Mike Keener, and we have two outstanding, wonderful guests. Look at that facial expressions. I mean, it's like we practice that or something. Well, we have Rachel Elmore and Jessica Dickson with us today, both Maryville graduates, so it's good to reconnect. So Rachel and Jessica, welcome.
Thank you for having us.
I guess, the first question, Dr. Keener kind of alluded to it already, was that, you've been in the Maryville program before, in our rehab counseling program. What brought you to the counseling program? How did you two join the big club?
My mom was actually talking about this with somebody in the last week. So I got my bachelor's at Maryville, psychology with a minor in rehabilitation counseling. And I snuck in a few extra grad credits in undergrad without anyone noticing. I initially applied to another university. We will not name them. Their admissions process was a joke. And once they kind of said a certain thing that ended it for me, I contacted Dr. Keener and was like, I need to get into the master's program. How do I do that? And I met with Dr. Keener and just got admitted into it. How was that?
Magic.
Yeah.
Right.
Just wave that wand and it happens.
Yeah.
Rachel, how about you?
My turn. So I got a bachelor's degree actually in biology with a minor in psychology. I went to Eureka College, alma mater of Ronnie Reagan. And then I wasn't sure what I wanted to do. I was really just kind of floundering, because obviously this was also a time in the world where if you didn't have that master's, like the door wasn't even open. But I didn't want to start something and not be 100% sure. So I just took gen ed classes at a community college. And one day it hit me that I could help people, both mental health and physical health, by being in the mental health field, because I really wanted to be a medical doctor, but chemistry and math are my Achilles heels. So then I was just kind of looking for different grad programs, and Maryville popped up, and I really liked that smaller college feel atmosphere, and also not needing the GRE was a big help after being out of college for a few years. But then came and visited and actually met Dr. Parker, and Dr. Parker was just like a force to be reckoned with and just this amazing woman. And I just felt like at home right away. So that's what brought me to Maryville.
I've always heard such positive things about Dr. Parker. That's always been...
want to go to total.
We're trying to come to this. We have her picture in the classroom still. So,
That's awesome.
Totally unrelated, but I never thought I'd hear Eureka College. My dad played basketball there in college. So it's funny that I was like, oh, I never thought I'd ever hear that.
Yeah, when I started looking at undergrads, I'm from a really small town, and all these huge colleges, it was just really frightening and overwhelming. And then I got invited to go for the Reagan scholarship. Didn't get it, but that's okay. And then I just fell in love with that small town atmosphere too. I thought that was really cool. Having classes of 5 or 6 people versus hundreds of people, it was just so cool. So I loved it.
Yes.
I love that.
it was meant to be. We are all together here having these connections.
Yes. People always think I'm in Eureka, Missouri. And I'm like, no, there's another one.
And now your next goal that you've told me, Rachel, career-wise, is you want to be a nurse.
Well, yeah, I really miss that medical aspect. And I've really been strongly considering going back and doing something in nursing. It's because of The Pit. That show got me. Just really want to be back in emergency rooms and doing medical stuff. So that's never gone away. That love of the medical part.
I love that. Where did you two end up post-grad? What was like your first, where did you two end up after you graduated?
So I have a lot less of an exciting story, I think, than Rachel. I went straight from post-grad to kind of annoying Compass to the point where they finally hired me. I sent in so many applications. At the time, it was called Kreider Health Center. And I started out as a QMHP caseworker. So I covered a caseload of anywhere between 20 and at some points up to 50 clients across St. Charles, Lincoln, and Warren County. I did that for about a year, then became a community support supervisor. Then from there, transitioned to an ITCD supervisor, which is integrated treatment of co-occurring disorders. And I spent my time there for about 7 years until I got into the current role that I am.
Which is?
I am the regional director for intensive CPRC, which is intensive community psychiatric rehabilitation for Compass. So I cover St. Charles County, Lincoln County, Warren County, and Jefferson County. And at this time, I have 12 behavioral health sites that I oversee the operations of. Yeah, it's a lot.
Well, Rachel, where did you end up?
So
post-grad?
I became a case manager at BJC Behavioral Health. Now we don't really have case managers. We have more community support specialists. And then I got the opportunity to be an intake coordinator with BJC. So that's where I really got to combine the medical and the mental health. We did assessments with patients in the emergency room presenting with suicidal ideation, substance use, those kinds of things, and just determining inpatient versus outpatient. And then that grew really large and started to cover all of BJC, both emergency room and people on the medical floor. But it was a work from home role because of COVID. So I really missed kind of being out in the world. And once I finished my doctorate in 2022, I started applying to professor roles, and that's how I got into being a professor at SLU. And even when I was with BJC Behavioral Health and all through different mental health agencies, I was always told Compass is where you want to be. And then the opportunity came to be at Compass. In my first role with Compass, I was a community behavioral health liaison. So we work hand in hand with law enforcement partners, going out to different people, providing mental health resources, showing that collaboration between mental health and law enforcement. And Missouri is one of the largest ones in the country, actually, and one of the most robust programs. And then from there, I interviewed for Jessica's role and didn't get it, but I became the person right underneath her. So I supervise 6 different residential facilities, and I'm in the St. Charles County and then Warren County. So I am a ICPRC program director and an adjunct professor at SLU. And I also work PRN at our youth behavioral health urgent care here at Compass.
Yeah.
I
Times.
was going to say, I love asking this question because it's always interesting to hear how people condense their careers into such a small, couple sentences, but I just have so many. Rich, I didn't know that you got your doctorate. What was your doctorate in?
In psychology. And
Okay.
so I finished at Maryville, and still, I just really had this yearning to still be doctor. And I was like, well, I'm not going to go to medical school. That's too hard. And about 2015, 2016 is when I started my doctorate. So a large part of it was still during the pandemic as well. So I had to change the route of my doctoral project from actual research to a little bit more theoretical, because I was looking at burnout in emergency room physicians and employees who work night shift, because that is what I was working at the time. And I was noticing physical and mental health changes in myself and the people around me. So I wanted to really try and find a way where we could be better and be at our best during those nighttime hours.
Here feeling all warm and fuzzy inside.
Because you started this.
Well, 3 wonderful graduates, and just to hear your stories and to know that Katie is working, with the two of you, and she's a ball of fire, and sort of predicting or thinking, okay, in 5 years or 10 years, are we going to have Katie back, and we can have, again, who is she now mentoring, right? As all of you. But Rachel, you sort of let a cookie out there. You let something for us. You said, so people told you that Compass was where you had to be. So why is Compass the place to be? Or maybe I'll reframe that. So, obviously we'll have entry level graduates, graduating soon, why would a Compass be a good place for them to start?
Compass really values like that work-life balance. I'm a millennial, so I'm always really anxious and I hate to ask for time off. And I'll ask for time off and be like, is that okay? And they're like, yes, weirdo, that's okay. But then they're really big on promoting within. Like, I had only been with Compass 7 months when I got promoted from my previous role to a director. So they really invest in their employees in multiple ways. They do tuition reimbursement. They encourage us to take on these PRN roles so that we can learn more and just grow. Leadership's very visible. They're not like these untouchable people who sit at the top of a hill. So that's what really always was kind of the draw. I always just heard really good things about the employee experience as well. That's kind of what I always heard.
Yeah, I would definitely mimic that, even though I started when it was Kreider and everything was still separated on paper. Very much so that work-life balance. And that's something that I carry as a leader for all of my staff too, of please take that time off. You guys have it. And yeah, leaders. So our CEO, Tim, started as a community caseworker and worked his way all the way up. The vice president of our department started as a caseworker in the 90s and worked her way up. So all of these people are not just people who came in with like a business degree or outside, and now they're the VP. They have truly grown in the company and they want that. So years ago, when we kind of knew higher ups were getting closer to that retirement age, the message was find out who would be good to want to go into the next step, to be a leader. Let's start training our staff because we know there's going to be a lot of movement upwards because vacancies will be happening. So even all the way back then, it's how can you grow? Let's figure that out. Let's get you into situations, taking up tasks to grow that. So I was very clear from the beginning when I started in 2018 that I wanted to be a director. Whatever that might look like, I wanted to be that. So from day one, every supervisor and director I've had has known that. So they have tailored my tasks and we call them AIMS goals. They're just what we do every year for employees. They've tailored all of that to get me to my goal. And now I'm sitting here as a regional director for our residential program. So it's a company unlike others.
That's huge. And I love that we're naturally talking about leadership now. I'm curious about you two. Like, how are you two? What are your leadership styles? What are things that you bring to the table? How are you similar or maybe different in your styles of being supervisor or director?
To say, I know I've had some supervisors in the past who have been very micromanager. And I feel like with the evolution of more things online, like with Teams, and it shows when you're not on it or just those kinds of things, it led to more micromanagement. But to me, as a leader, a lot of these people were already in place before I got here, and they got here for a reason. They were already managers and supervisors for a reason. So I kind of see myself as more of like that advocate and that backup. And I think that's also why I'm a professor. I've really stepped away from like the clinical aspect and working directly with clients, because I want to be the one who's mentoring the future mental health professionals and leading the current ones. That's a really big thing to me, is to kind of have that gap. I'm very, easy to get in touch with. Even if my door's shut, I say it's an open door policy. I'm here. And I think Jessica and I align a lot in that. And we almost, as supervisor and supervisee, like when I call her, she probably already knows why I'm calling, and vice versa. We're the same. So we have a lot of kind of letting our employees do what they need to, and then making sure that we're there more as that guiding piece.
Yeah. I have 3 directors under me, Rachel being obviously one of them, and they are so similar and so different. My other director is currently in his PhD program, so I got 2 doctors under me. But I hope, and I check in with Rachel and I check in with the other directors too about how I'm doing for them as a leader. I very much so. It's an example. So if I'm not willing to do something, I'm not going to ask a staff member to do it. And with that being said, I am on site as frequently as I can be. If there is a shift, because our programs are 24 hours a day, 7 days a week, like there has to be staff. That's not an option. So if I have a shift open and for whatever reason I can't find a staff member to cover it, none of my directors or my leadership under me can cover it, well, guess what? I'm going to be a CLI for about 8 hours. That's just my style, is I'm going to be as present. I do not like to micromanage, and I'm very upfront with all of my staff that I really don't want to. And if I do, like, we got to have a conversation. I tell Rachel all the time, she helps keep me afloat with all of the things that I have to deal with. I never have to worry about Rachel. And I know that if I forget something, Rachel will remember it for me. And we always work on like delegating. So I do ask Rachel, like, if she needs something from me, please give it to me and I will do it for her. If she is overwhelmed or doesn't have time, whatever. So I view it as it ends with me. Whatever needs to get done, it's not going to go past me.
She mentioned something as well, like, I'm not above doing what I'm asking people to do. I came from a previous setting where I was doing all the roles and supervising multiple tasks and juggling a lot of, different balls in the air. So when I came to this, I started trying to do all those things and they're like, no, someone else does this. So I really struggled to learn how to like delegate, but I think Jessica's been really good at teaching me that too. So.
Well, so I'm going to switch gears a little bit and again, thinking of students and practicum and internship and I'm assuming that there's a process for for students to sort of apply or to look. Can you talk about that a little bit?
I'll say it's actually on our careers page. There is actually they just did a big website update, but I think it's for like interns or practicums. And there's a bunch of different opportunities. And that's the other beautiful thing about Compass that I didn't learn until I started working here. We do a lot in a lot of places. So that's another cool thing. If you're, starting to kind of feel more burnt out or just not as enthused about the part of the program that you're in, there's so many other things you can do. And so actually I taught one semester at Lindenwood and I had a student there that was looking for an internship. And then she actually turned up at the youth urgent care where I do my PRN hours. So I thought that was really cool. But yeah, we have a really good, it's pretty robust with getting people in for their intern. And then if someone's provisionally licensed, you get your licensure here. So you're not out searching for that piece either.
That's how I got my licensure, was through Compass. They provided a supervisor, and bless him, he was a youth therapist for years out in the middle of Missouri. He's an outpatient director for us. And he learned a lot about CPRC, that community support aspect, and he dealt a lot with my questions and everything. But that is a massive bonus that they have so many licensure supervisors. You just apply for your paperwork, you get provisionally licensed, and you're good to go.
Same with psychologists too. So we have it kind of all across the board.
Yep.
I think I still identify as like a recent grad. At a certain point, I'll stop identifying as that, and I'll realize how old I'm getting. But from a post-grad lens, I've seen therapists that are just entering the field feel a little like iffy about going into community mental health or going into like nonprofit agency work or anything that's kind of similar or looks or smells like a Compass. And what I really like about this is that a lot of the things that I've heard as worries or like getting burnt out or getting lost in the weeds or, oh, it's a huge organization, like they don't really know me or anything like that. A lot of what you're saying is kind of the exact opposite of a lot of the worries that I have heard from other graduates or people in a counseling program of looking for like, okay, well, where should I go right out of college? And those worries, that doesn't seem to be the case is what I'm gathering.
Yeah,
No.
I'm actually one of those people where I don't think this was in Dr. Keener's class, but in my last class for my internship, like I started crying because I was at a private practice and I was like, I don't want to do this. Like this, did I just waste all these years and I don't want to do this? And it really took like that opportunity to open my eyes and see that just because you're a licensed professional counselor, I could probably count on one hand how many like true therapy sessions I've done because there's so many other things we can do. And these community mental health agencies that I've worked for, like BJC as the intake coordinator, was a community mental health nonprofit. And then same thing here. I think it opened way more doors for me. But I think, there is always that fear that with nonprofits, that the funding will go away or you'll lose your role. And Compass is really big on, making sure they do what they can to keep as many of us here as possible when they face those challenges. So it's like a breath of fresh air.
So one thing that I had noticed when I first started, way back when it was Kreider, is I had a tendency not to pay kind of attention to like little like HR things that just like maybe if I got a little tiny pay bump randomly, I just never paid attention to that. My boss would have to tell me, oh, by the way, you have been rebased based on the Missouri average. Okay, that's interesting. I've been here for like 3 months. Like, cool, I guess. So I learned that our CEO either at some point, I don't know the exact frequency, but is always checking the Missouri average for the pay for our roles. And if it increases, the roles pay increases to keep us above the average. And we just did our year end stuff for like, bonuses, incentives, all of that stuff. And they even said in the email they sent of like some positions have been rebased based on the state's average. So that's always happening, whether or not it's out like expressed outwardly or just quietly in the background. Compass gives a lot of money to the employees. Now, as inflation is happening and everything, like everyone deserves a pay raise. But for a nonprofit, we are definitely above, I think, the standard in the state of Missouri.
I'm glad both of you said that because it seems as the longer I teach, the more and more students like they get, is Brait was saying, narrow focused is, well, I'm doing private practice or I'm going to start my own practice or I'm going here. And again, that's fine. I know we still say it as instructors that, well, we would prefer that you would be in an agency first to get some experience before going to a private practice, especially if it's you just on your own or you with one other person, like have, what's your network or what's your other experiences? Or maybe you can quote unquote, borrow some, well, this is how they do their informed consent, or this is how they do this paperwork. And then sort of, besides just sort of like, again, going out on your own. And I guess a similar thing you talked about, Jessica talked about getting supervision, as part of employment. I think that's wonderful. And I think from being a larger agency that helps, when you're getting supervision from a smaller agency, and how do you talk about the agency sometimes when, like they're best friends with my boss and I gotta, at least there's some a little bit more of that separation, or maybe not as much of a dual role there, or feeling like you can't share. So I guess I hope I'll make sure our students listen to this podcast to see the positive.
I'll make sure they listen at SLU too.
There you go.
Esther did this. I'm big on that too with students. I'm like, you guys, I feel like a lot of them do. And I feel like in grad school, I had those blinders on and I was like, I can only be a therapist and I can only do, because that's kind of what sometimes there's the portrayal. And then, people come in and I talk about my experience both at Compass and BJC Behavioral Health and my internships that I did at Maryville as a professor. And I let them know, like, ahead of the thing, I have no educational, background to be a professor. I'm here because of the experience I've had in the field. So I feel like a lot of the students I've worked with have had like their eyes open, because to them, that's really all there was you're a therapist, you sit down with people and you do therapy.
Exactly. Yeah. I think in my professional opinion, I've told this to so many people, is if you want to do therapy, great, awesome, 10 out of 10. My licensure supervisor forced me to take on a few therapy clients so he could confidently say I could do it, sign off on my paperwork. And it really affirmed for me I did not want to do therapy. So I think for a good base for mental health professionals in whatever capacity is some type of community mental health. Whether that's working in like something like what we have, which is the mental health residentials, or in community support where you are going out to these clients because you see things that doctors, therapists, anyone else doesn't see about the lives that these clients are living. I've had doctors and therapists say like, oh, like it shouldn't be that hard for them to do X, Y, and Z. It's like, you don't understand. This is what their house looks like. This is who they live with. This is the area they live in. So to be able to be truly foot on the ground, front line, to see how these people live and to see their struggles in real time makes a massive difference in how we think of people and view the mental health profession, and our clients.
And, Jessica, I'm so glad that you brought that up because that was going to be kind of similar to what I was going to ask, which is once you get into a leadership role or a director role, you're kind of able to see the big picture a little bit better. You're not doing as much client facing time, so you're kind of able to see like big macro trends. What are the trends that you two have seen kind of like from the mental health side or from just like the clients that we're serving?
So we've been told, because the company is big enough, we have so many departments and so many people who can focus on different things. Recently, we were told that the overdoses are showing a sign of decreasing. Now, any overdose is too much, but there is starting to show a trend down for overdoses. When I was an ITCD supervisor, many people, this society and the general population think just don't use drugs. That's all it is. Abstinence is the only way. Kudos to you for those thoughts. If you can do it, awesome. Realistically, that's setting up everyone for failure. So when I would have new staff who didn't understand, why am I instructing them to, instead of saying, we'll stop using meth, okay, instead of using an IV, can you snort it? Or if you are going to use an IV, can we make sure you have multiple different needles and you throw them away? Or here's the never use alone line. So that has slowly been helping to decrease those. And they recently, I think it came out that all kratom sales in the state of Missouri have to be paused, which is great. Because everyone has a misunderstanding of kratom. And honestly, it could be laced with heaven only knows what, because it's not regulated or anything. Suicides, I don't know if there's been a change necessarily, but one, just like overdoses, one is too many. And hopefully we can get to that point. But we have a whole suicide care committee who monitors and figures out our workflow and how to improve it. And whenever there is a death at Compass, whether it's natural and expected versus a suicide or even a homicide, because I've had one of those before, they bring the entire team and a quality department member to come together and go through the chart. Let's look at this. Let's discuss moving forward. Is there something that we could have changed in our way, in our work to maybe alter this outcome? Or, is it just this was going to happen? There's nothing we could have done differently. And it's not to put blame on anybody, but just to kind of look at that and take that information and apply it for the next scenario.
I think another big push right now, too, is focusing more on primary care. I remember even as a young mental health pup, learning about the metabolic disorders, and people with schizophrenia are higher risk for losing their life at an earlier age. And it's strictly from, primary care perspective. So there's a really big push right now too, when people are scheduling their therapy or their psychiatry sessions, saying, hey, do you have a primary care doctor that you see every year? Because we offer that too. We offer dental. So it's kind of, I'm really glad that at Maryville, I learned all those different dimensions of wellness, because it already taught me to already kind of think that way and start looking at those other things. So that's kind of been a really big push too. And I think it's just things are always changing from one day to the next. So just being able for us to kind of roll with those changes too is what I see.
And actually going with that, so when I started at Kreider, the average death of somebody with a serious and persistent mental illness was about 25 years sooner than the general public. In the last probably 2 years, they've come out and said that has been decreased to 20 years before the general public. So we are seeing a improvement in that. And that big thing is metabolic screenings, health screenings, primary care, all of that, and that integrated treatment between psychiatry and primary care too, so that there's no overlapping of medications, or one's not prescribing medication that counters the other one, or vice versa.
I think a lot of what we've seen too is how the world looks after COVID too. I mean, we're 6 years out, but we're still doing a lot more virtual things. We're also seeing, as someone, when I was working in the emergency room, we started seeing people who had never had a mental health history who started having suicidal thoughts and anxiety and depression. And then we started seeing that they had COVID and they were asymptomatic. So just learning those things too. We're still learning every day what COVID has done to all of us in the mental health world, because you don't think of, oh, my lungs are going to, impact my thought process or my emotions. So that's been a big one too.
Yeah, because That does remind me, that is a big thing because Rachel and I work, especially with people with schizophrenia or delusional psychotic disorders. So when they are starting to struggle physically, we can see an increase in their symptoms. And it's figuring out, okay, what's happening physically, if that is it, or is it the medication change? And I have a client right now at one of my sites that has a breathing disorder and is supposed to be wearing oxygen, is not wearing the oxygen, and we're seeing an increase in their psychiatric symptoms. So it's okay, now we're not getting enough oxygen to the brain on top of we're not taking our meds. Like, this is worsening the psychosis.
The only thing that I was going to say was that I feel like you two should have your own podcast now at this point. Like, you two bounce off of each other really well. I'm like, oh, wow, I just want to.
I mean, if they want to record our supervisions, it's fun to watch, I think.
If the two of you can do a podcast, so, I mean.
Maybe we will. You never know. Like, I may feel old, but I'm still young, I guess. So
Right. This is like, Happy Days launching Mork and Mindy, for those. Maybe you didn't know that. You don't know Happy Days or Mork and Mindy, but Robin Williams, he started on Happy Days, then got his own show. It's just like Laverne and Shirley started from Happy Days too. I mean,
Rachel,
and Mom
don't
led
hate
to
me.
girls, right?
Rachel, don't hate me. I don't know the reference.
Neither do I. I don't know.
Rachel
I get really
gets so sad when I don't know references.
I get really mad. I'm like, you didn't understand that GIF or chip or whatever. I'm like, you didn't understand that, did you? And then I get like so disappointed and remind myself that I'm older than her.
I try to fake it because I don't want to upset her or disappoint her, but she knows it.
My boss, and she doesn't want to disappoint or upset me. I love it. No, literally, I'll be like, you didn't get that, did you? It just reminds me I'm old, but that's okay.
send it my way, Rachel. We can talk about it.
No, you'll get it. Thank you.
Well, we usually kind of wrap up with everybody giving a mentor moment. So do you have a sort of a food for thought or a tip for a young lad or a laddess, a young man or woman entering the field? What would you say?
I liked what Katie pointed out the other day. I think a lot of us, and we've even touched on it here, we go in with these blinders that we have an LPC, we can only be a therapist, there's not other experiences. I think it's really important to, like you mentioned, network, look on LinkedIn, look what other people do.
Yeah. My big thing is to give yourself grace. It is what it is. We kind of always say, like, everything can be fixed as long as a client didn't die. So I know that's morbid to think of, but at the end of the day, that kind of helps recalibrate, like, okay, I didn't get this report done today, or I didn't respond to this person today. That's okay. Also, if you're going to work in mental health, don't be afraid of the clients. Just don't, because clients get that all the time already as it is. They don't need their mental health professional also kind of giving off the vibe that they're scared or intimidated by them. So that would be the big things I would say.
I love that. Any last pieces? Any other things? I feel like we covered a lot of bases with this episode.
Let us know how to start our own, and we will get out there and do the Jessica and Rachel show.